which of the following is the most appropriate next step in management to prevent Rh hemolytic disease of a newborn? So you either administer to the mother or to the mother, instruct further of employees' future pregnancies. Transfusion compatibility. Let me see, intrauterine transfusion. Screen the newborn. Yeah, see, I'm reading the answer choices and it all depends on the angle they come from now with the Rh. Okay, 28-year-old prima gravida woman with O negative is 32 weeks gestation. She has uncomplicated pregnancy. Screening's all normal, but her husband has positive. Okay. Discuss the possibility of Rh hemolytic. The obstetrician discuss the possibility of this hemolytic disease in the newborn. Which of the following? Yeah. Okay, so we're 32 weeks pregnant. Let's see, when do you usually give row? I think it's 28 to 32 weeks is when you usually give it. Let's see, administer. I don't think transfusion. I think transfusion was like something's bad happening to the fetus. Screen the newborn. No, you definitely need something sooner than. I don't think it's CD or E. I think it's between A and B just to verify. Administer immunoglobulin or RD. So I think it's B.
Okay, final answer.
Yeah.
Okay, good. Talk to me. What is ROGAM? If we always talk about it, right? ROGAM. What, like, do you know the mechanism how ROGAM works?
Is it hemoglobin F or no? I know it's like an antibody that like, so I know if Rh positive is the baby and Rh negative is the mother, or if there's a difference, you can cause harm because it's like an autoimmune thing where it's going to attack the antibodies or whatever, right? So if you're giving an immune globulin, I just know it's like helping prevent like an attack on one of the globulins or something. But
Yeah.
I don't, something like
So
that.
yeah, for sure. So you I would say you're everything that you say is correct. I just want to add another layer of your understanding so that you don't forget it, right? So
Right.
you're giving an immunoglobulin. I always say it's kind of like, everyone remembers that this looks like an immunoglobulin, right? So ROGAM is just an immunoglobulin that you're giving to for mom. Okay, just remember it's for mom. Okay, so you have these immunoglobulins floating around mom's blood. Okay, and this only works if mom's, for the most part, has never been exposed to R RH positive antigen. Okay, so these antibodies, right, or these immunoglobulins that float around mom's blood, its whole purpose is to mask any kind of Rh positive antigens so that mom cannot create antibodies against Rh positive, if that makes sense. So for instance, right, if you have all these, immunoglobulins floating in mom's blood, and let's say when she gives birth to this, let's say baby happens to be Rh positive and some of that blood mixes with mom's blood, and you have Rh positive antigens floating around in mom's blood now, this ROGAM can then attach to the RH.
You're saying the RH or the positives coming from you're saying if it's a negative mother but a positive baby, is that what you're saying?
Yes.
The
Okay.
the positive can get into the mother's bloodstream?
Yes, because
Okay.
there's some people say that when you have, especially if you have a little bit more bloody of a delivery, right? Baby's blood can sometimes mix with mom's blood. Okay,
Yeah.
because remember, there's a transfusion with the umbilical cord and the placenta and things like that. So if you have a little bit of mixture of blood, then that Rh antigen is now exposed to mom's Rh negative blood, which that means that mom's blood is like, whoa, there's like an invader. You get what I'm trying to say?
Yes.
So then mom will want to try to create antibodies against Rh positive, which is not good, because if mom ever had another kid, then that antibody can cross the placenta and the placental barrier and then kill baby and cause like fetal hydrops, right? So how
Right.
you want to prevent that is you give them ROGAM. And ROGAM is just your insurance, right? That if there's any kind of mixture of blood, this antibody will then attach and hide the Rh positive, so mom's body can't see it. Does it make sense?
Yeah, and I think it's important too because it helps prevent that kind of adaptive immune system, right? Because then after the
Exactly.
second, third, fourth pregnancy, if you didn't do that, then that's even worse, I think, right?
Exactly. So practically what the whole point of ROGAM is to prevent that adaptive immunity, like you're saying, of mom to create these antibodies that will kill or attach or attack Rh positive antigens, right? And like you said, right, it protects you from future pregnancies of developing fetal hydrops.
And
So
that's what when it's O negative, A positive, that positive negative thing and all the blood types, is that related to RH?
yeah, when they say positive negative, is they're talking about Rh.
Okay. I don't know for OB, like how much you have to know, like A versus B blood type versus O, if that's a huge thing or not.
Yeah, just I mean, the way I think of it, on kind of a blood standpoint, right? You have O, A, B, and AB, right?
Right.
Those are your blood types, and then you have positive and negative, right? And that deals with Rh.
Yep.
Okay, so you have multiple combinations, right? Obviously, if you have O, O negative is going to be your universal donor, right? Because you have no antigens at all. Does it make sense?
Yeah. Yeah.
Okay. And then AB is a universal or AB positive. Yeah, AB positive is the universal receiver, right? You can get O blood, you can get A blood, you can get B blood, and negative or positive doesn't matter. You get what I'm saying?
Yep.
Okay. And the rest, right, makes sense, right? A just means you have the A antigen, B means you have the B antigen, AB means you have A and B antigen, positive means you have Rh positive, negative means you have Rh negative. That's all you need to know about blood types.